Hello everyone. Today I will present our study on ordinal sentimental classification in Cancer Support Forum. The central idea is that online support forum contains natural language expressions of fear, uncertainty, coping, and caregiver strain. We ask whether machine learning models can classify these posts into ordered sentimental category in a way that is useful and vulnerability-oriented monitoring. The study is not framed as diagnosis and is not framed as autonomous intervention. Instead, it is controlled benchmark that evaluates classical machine learning, recurrent neutral modeling, and transformer fine-tuning under same split evaluation protocol. I will walk through the motivation, the dataset, the model comparison, the error patterns, and the practical implication for human supervised support workflow. The first motivation is that many patients and caregivers use online support community to describe experience that may never appear in a structured clinical note. This post can include practical questions, emotional disclosures, and peer support, often in the same paragraph. That makes the language useful but also difficult to interpret. A phrase may contain medical terminology that sounds severe, while the overall tone may be relief or coping. For this reason, the study treats sentimental classification as only one component of digital phenotyping. The model output is meant to support human review, such as moderator or support staff deciding whether posts need attention. It should not be understood as diagnosis and should not be automatically trigger clinical action without human oversight. The research question is straightforward. Which model family best capture ordered sentimental intensity in cancer forum narrative? We did not propose a new architecture. Instead, the contribution is a controlled comparison. The benchmark include classical sparse feature baselines, an ensemble model, a recurrent model, and the two fine-tuned transformers. The evaluation was designed to avoid relying on a single aggregate number. Weighted F1 was used as the primary selection matrix because the classes are imbalanced. But the paper also report macro 1 versus rest AUC. Class-specific precision and recall, bootstrapped confidence intervals, and paired MC NEMR test on the same held-out test set. Finally, because the labels are ordered, the error analysis asks whether mistakes are adjacent on the scale or whether they cross larger effective distance. The dataset contains 10,000 post-level instance from mental health insights vulnerable cancer patient dataset. The source annotation used 4-point ordinal emotion scale. In this study, those labels are mapped to 4 sentimental classes: very negative, negative, neutral, and positive. The distribution is imbalanced. Neutral posts are the largest group at 42.1%. Negative posts are close behind at 39%. Very negative posts make up 7.1%, and positive posts are only 7.2%. This matters because the minority classes are operationally important. In particular, very negative posts may represent higher distress, while positive posts are harder to learn because they are less common and often mixed with treatment update. The pipeline was designed to make the comparison fair. All models use the same clean post tags and the same map labels. The difference is representation used by each model family. Classical machine learning models use TF, IDF, unigram, and banagram features with up to 10,000 dimensions. The recurrent and transformer models use token sequences with maximum length of 200. The data split is two-stage holdout design, 60% training, 20% validation, and 20% final testing. Hyperparameters are selected only on the validation set using weighted F1. Then the final metrics are reported on the holdout test set. The structure reduces optimistic bets from tuning and makes model comparison easier to interpret. The model spans three broad ideas. The first group is sparse feature classical machine learning, logistic regression, random forest, and LightGBM. These models are useful because they are efficient and more interpretable, especially through TF-IDF feature importance. The second group is the GRU, which provides lightweight sequence model and task-specific embeddings. The third group is transformer fine-tuning, represented by Albert and Belbert. Albert is a compact general-purpose transformer, while Belbert uses biomedical domain pre-training. The evaluation also has several layers. Weighted F1 is the primary selection metric. Macro 1 versus RAS AUC measure separatable. Consequence intervals describe uncertainty, and MC-Namar tests compare whether two models make the different correct and incorrect decisions on the same test posts. The main aggregate result is transformer fine-tuning produced the strongest performance. Albert achieved the highest weighted F1 at 0.7 and highest macro AUC at 0.9. Belbert was very close with a weighted F1 of 0.76 and the macro AUC of 0.91. Among the non-transformer models, LightGBM and the logistic regression formed a strong second tier, with LightGBM reaching a weighted F1 of 0.7. Random forest and GRU were weaker overall. One practical interpretation is that contextual representation help with mixed multi-sentence effective signals in supported forums. But strong classical baselines still provide useful reference points. The paired statistical tests add important nuance. Albert and Belbert significantly outperform logistic regression, random forest, and GRU after Bufferoni correction. However, neither transformer was significantly different from LightGBM after correction, and Albert was not significantly different from Belbert. This means the aggregate ranking is informative, but it should not be over-interpreted as a universal hierarchy. In practical terms, Albert had the best weighted F1 and macro AUC, while Belbert has slightly higher recall for very negative posts. LightGBM remain a competitive non-transformer baseline. Therefore, deployment decisions should consider the intended workflow, whether the priority is high recall for distress, balanced performance, model size, latency, interpretability, or ease of maintenance. Class-specific results show very aggregate score is not why the aggregate score is not enough. For the very negative class, Bellbird has slightly higher recall, 0.8 compared to 0.7 for Albert. That may matter in a workflow where missing potential high distress pose is especially costly. For positive pose, however, Albert had much higher recall, 0.7 with 0.5 for Albert. Positive sentiment was also least prevalent category, which make it harder to learn and evaluate reliably. This result suggests that model selection is not only about which model has the highest average score, it's also about errors are most acceptable for the intended screen or support workflow. The confusions matrices help show the structure of transformer errors. The strongest counts are along the diagonal, which means both models correctly classify many poles in each class, but the off-diagonal patterns are also important. Many mistakes are not random. They tend to occur near adjacent sentiment boundaries, especially between neutral and negative, and between negative and very negative. This pattern makes sense in a forum context. A post can contain symptom descriptions, uncertainty, and informational questions without a clear negative emotional tone. Another post can contain distress, but not reach the most severe category. The key point is the ordered labels change how we interpret errors. A one-step boundary mistake is different from reversing the apparent effective direction of a post. The error analysis points directly to deployment safeguards. For Albert, 75.5 of errors were adjacent on the ordinal scale. For Bellbird, the number was 81.2%. That suggests many errors are boundary issue rather than completely random failures. However, some errors remains operational important, especially when positive poles are misclassified as negative or very negative. The paper also identified two all-model failure cases in medical keyword masking, abnormal lab values, or clinical terms that can dominate the model signal even when the post express reliefs. In first post, boundary ambiguity, introductory symptom description can be labeled as negative even when the true label is neutral. The practical safeguard is to keep the human in the loop and route low confidence or medically silent post to manual review. In conclusion, transformer fine-tuning improve holdout performance or ordinal sentiment classification in cancer patient and the caregiver forum narratives under a single 60-20-20 split. Albert delivered the strongly weighted F1 at macro AUC, while Albert remained closely comparable and showed slightly higher recall for very negative post. At the same time, the study emphasizes caution. The dataset is a public corpus. Labels are inherited from the source dataset. Inter-annotator agreement was not reported. The split is a post level rather than user level. and robustness across platform and time has not yet been established. The most important takeaway is that these models are promising screening component for vulnerability-oriented monitoring, but they require collaboration, boundary-focused refinement, transparent error review, deployment profiling, and human oversight before real-world use. Thank you everyone for listening.